Thank you. I'm going to turn it over to Zulfiqar Bhutta, who, by the way, needs no introduction.
Yeah, I'm happy to skip my part of the introduction. Thank you, Kimber. Good morning and welcome to all of you to this absolutely fascinating 2 days. And thank you also for those who have spilt over into the other room. I know that this is going to be a full day, so we need to be cognizant of people who are in the side spillover room and perhaps can see and hear us, but not necessarily participate in the same manner. And we have also a whole lot of people who are following the web streaming of this and will be sending their questions in our open session. So I'm going to take some time and ensure that they are part of the conversation. So this is our workshop on the cost of inaction. And the workshop is principally focused on some of the objectives and agendas that I will go into in some detail. We have an hour for this session, and I have absolutely no desire to speak for an hour. So what I'm going to do is to invite our forum members, the formal forum members of this investment in young children globally, to introduce themselves, and they are sitting in order, so we'll go through them. And we recognize that there are a fair number of guests here today and speakers, and they will be introduced as the day proceeds. Otherwise, we'll spend our entire 1 hour on just the introduction. So may I start with Amina? If you could just maybe pass on then, and the forum members can introduce themselves.
Hi, my name's Amina Abubakar. I'm a developmental psychologist from Kenya. Thank you very much.
Hello, Eduardo Queiroz from Brazil. I'm the director of Maria Cecilia Souto Vidigal Foundation.
Good morning, everybody. My name is Simon Sommer. I'm the head of research at the Jacobs Foundation in Zurich, Switzerland.
Angela Diaz, I'm a pediatrician, and I run adolescent medicine at Mount Sinai School of Medicine in New York.
Buenos días, yo soy Constanza Alarcón y hago la coordinación de la Comisión Intersectorial de Primera Infancia en la República de Colombia.
Welcome. We have simultaneous translation for people who would like things translated real time. Go ahead.
Hi, good morning. I'm Pamela Collins from the National Institute of Mental Health, the Office for Research on Disparities in Global Mental Health.
I'm Sarah Klaus. I'm the director of the Early Childhood Program at the Open Society Foundations, and I'm based in the London office of the Open Society Foundations.
Hi, good morning. I'm Albert Lee. I'm a professor of public health and primary care at the Chinese University of Hong Kong.
Hi, good morning. I'm Carly Silver, and I'm the VP of Targeted Challenges at Grand Challenges Canada.
Good morning. Gary Darmstadt, Senior Fellow in Global Development at the Bill and Melinda Gates Foundation.
Hi, I'm Joan Lombardi, representing the Bernard Van Leer Foundation.
Hi, my name is Rebecca Stoltz-Fuss. I'm a professor in nutrition at Cornell University.
Hi, I'm Gillian Hubner. I'm with the U.S. Agency for International Development in the Center for Children in Adversity.
Good morning. I'm Vesna Kutlesic, Director of Global Health at the Eunice Kennedy Shriver National Institute of Child Health and Human Development, iYCG. Thank you.
Good morning. Andy Scher, Senior Vice President, Autism Speaks.
Larry Aber from the Institute for Human Development and Social Change at New York University.
Chloe O'Gara from the William and Flora Hewlett Foundation, the Global Development and Population Program.
Good morning. I'm Kelly Willis, Accordia Global Health Foundation.
Alan Pence, University of Victoria, Canada, and UNESCO Chair for Early Childhood.
Good morning. Taryn Morrissey, the U.S. Department of Health and Human Services in the Office of the Assistant Secretary for Planning and Evaluation.
Good morning. I'm Rana Haji. I'm from the U.S. Centers for Disease Control and Prevention, CDC. I work on child health and global child health and vaccines.
Jose Pepe Saavedra, Chief Medical Officer and Head of the Nestle Nutrition Institute.
Morning. Mark Miller, Director for Research at the Fogarty International Center of the NIH.
Hi, good morning. My name is Raquel Bernal. I'm a professor of economics and the director for the Center of the Study of Economic Development at Universidad de los Andes in Bogotá, Colombia.
So did we miss anyone in the front row? I think Kufi, perhaps.
Kofi Mafo, Professor of Educational Psychology, University of South Florida, transitioning to be Director of the Institute for Human Development at Aga Khan University.
Welcome. So thank you very much for, as you can see, we've got a fairly diverse and a stellar forum with members representing a range of disciplines and diverse backgrounds. What I would like to do very succinctly is to try and capture the reason why we are here and then summarize what we did in our workshop earlier on this year in January. And I would then open the floor to any of the forum members to perhaps input into this. So this forum, in addition to the members who've been identified, is also very grateful to many of the sponsors. I will not go through that list, but you have them in your folders. People who have made this possible. I'm also very honored to be co-chairing this forum with Ann Maston, who isn't with us today, but will be joining us tomorrow. This forum was launched, was designed about a year ago through an initial planning grant made by the Bernard von Leer Foundation, who's represented here by Joan Lombardi as a forum member, and also we would like to thank Lisa Jordan, and also the Doris Duke Charitable Foundation when Mary Bessette was at the foundation. The first planning meeting for this forum took place in March 2013, and the second one last summer in June. Those meetings were largely to consider if a forum was necessary and what one was established, what ought to be the ethos and the objectives of such a forum. And from that emerged the entire vision, objectives, and the goals for this forum on investing in young children globally. The Institute of Medicine and its Board on Children, Youth, and Families and the National Research Council collaborated with the Institute of Medicine Board on Global Health in launching this forum in January this year. The forum seeks to create and sustain, over a period of 3 years, an evidence-based community of stakeholders from both the North and the South in a dialogue to explore existing new and innovative science and research from around the world to translate this evidence into sound and strategic investments in policies and practice, which will make a difference to the lives of children and their families. That's a tall order. And that's essentially the entire agenda for the post-2015 landscape. We are moving from survival and a narrow focus on the Millennium Goals for maternal child health and a few additional key global indicators to sustainable development goals, where there is an additional dimension beyond health. So this forum couldn't be more timely in terms of informing that dialogue as it takes place. The forum activities are supposed to be very interactive and focused on bringing in a range of views, the diverse views from across a diverse group of stakeholders. The activities will focus on highlighting both the science basis for much of what we are doing, bringing in economic perspectives on why in these investments should take place, particularly in low resource countries where there is an envelope constraint. And this needs to also span the landscape beyond health. So it needs to cover the whole marquee of investments around health, education, social protection, nutrition, and addressing poverty alleviation strategies. The hope is that the forum would come up over this next 3-year period with a holistic view of children and families by integrative analyses and bringing together disciplines such as economics, such as social sciences, such as health, nutrition, and development, to span not only neurons to neighborhoods, but microbiomes to culture. And this vision of an integrated concept of investing in young children in those key parts of the world would be fundamental to the strengthening of human capital over the next several decades. What is planned, as you would have guessed from this exercise, is a series of stakeholder consultations, with each workshop focusing on one specific aspect, such as the focus of this particular workshop on the economic basis for the investments. Other workshops will explore other dimensions. And by the time we finish our exercise, hopefully we would have covered many aspects of not only the science, the integrated framework, but implementation, scaling up, and importantly, bridging some of the equity gaps that exist around this area. Now, we recognize that this is our lens, and it requires necessarily keeping our ears and eyes open to voices that come from the South and also voices that come from across disciplines. The forum has set itself some very specific goals that I will now articulate, just so that everybody understands what the broad forum goals are for the next several years. So the set of forum goals include identification of an integrated science on children's health, nutrition, education, and social protection, and to work with policymakers, practitioners, and researchers to raise awareness of the integrated approaches to improving the lives of children and their caregivers. And we hope to do this through a set of 4 specific objectives. The first objective is to shape the global vision for healthy child development across cultures and concepts, from preconception to at least age 8, and crossing the current silos of health, nutrition, education, and social protection. The second goal is to identify opportunities for inter-sectoral coordination between researchers, policymakers, implementers, practitioners, and advocates to improve quality practices both within public and private domains, and to bring these to scale. So we are looking at change at scale. The third forum goal is to inform the current ongoing dialogues between groups working on issues of young children and families globally. And I've already addressed how we hope that the forum activities will inform the Sustainable Development Goals and some of the indicators that are in front of us. And that work will, although conclude this year, but there will still be porosity around the margins for us to influence some of the thinking around the way we collect, monitor, and impact those indicators. Importantly, the forum aims to identify both current programs that look at financing across health, education, nutrition, and social protection within the reproductive maternal child health framework, and to look at innovative ways as to how that resource generation and also resource allocation can be improved. So we want to make a tangible difference through our dialogue and deliberations on how resources can be made available for some of the activities that we will lay in front of us. And that's a real tall order. In most countries globally, policies around these sectors are rarely made by either ministries of health or ministries of social protection. They're generally made by ministries of finance. And that's why this particular aspect is so important for us to influence the global political dialogue and leadership. Now, to do all of this requires engagement by all of you, not just the forum members who are the formal forum members, but all of you distinguished invited speakers and participants, given that there is a public nature to many of these meetings, to give us your views bluntly, transparently, and constructively. So challenge us, give us your thoughts on how we can make a difference, both within the short, intermediate, and long term. That, ladies and gentlemen, is our target for the next 3 years. For this specific workshop, you have the agenda in front of you, and the agenda is targeted towards imbibing a lot of information that our distinguished speakers will share with us, The format is that there are moderators assigned to this specific task so that you don't have me speaking all the time, and I'll be thankfully in the audience listening to you. My unenvious task would be to summarize some of those proceedings either at the end of the day or the next morning, which I will try and do justice to. And then we will not make an effort to achieve a consensus in terms of the recommendations by the end of the workshop. This is work that will happen iteratively, and they will be summarized. The workshop proceedings will be summarized, and some of the decisions thoughtfully over the next few days. There will be a closed session of the forum tomorrow. So at lunchtime tomorrow, the open sessions of this particular workshop will conclude, and we will then have a chance to discuss among the forum members ourselves what the next steps are and what the format for the next workshop should be. I want to take a few minutes at this stage and just to try and briefly summarize the workshop that took place in January, which was our launching meeting to start this forum activities on. In your book that you have this under tab 3 at the very end of tab 3, and I don't intend to read the entire proceedings or the agenda and its outcomes verbatim. But just to summarize, that we principally met over a 2-day period, just like we are doing now, and it was an extremely interactive meeting, with the beginning being a recap of the planning meetings that had taken place in 2013, and then specifically focusing on the objectives, missions, and goals of the particular forum. We had consensus amongst people who were present and articulated some of the work from 2013 also, that the forum should focus on 4 specific objectives. Firstly, this should be a global forum with a reach beyond geographic boundaries. So although forum members may represent a clustering of people from any one or 2 geographies, our scope is global. So we want to reach out to children in every part of the world. That our work would go beyond health, or even health and education. So the focus is on inter-sectoral coordination. This is what we very overwhelmingly heard. There was a sense expressed in the January meeting that because of the nature of the dialogues that are going on right now with the SDGs and the post-millennium development goal scenario, that there was some level of urgency of translating some of our conclusions and syntheses into policy briefs or documents that we need to share with concerned people. And then it was very clearly articulated in January that to put a dollar and dime figure, how much will this all cost? The financing and the economic dimensions of our work was unique and important, and was also in synergy with what other agencies and groups are trying to do in this space. This has to make sense to people in terms of not only the value to human society in the long term, but also that this is cost effective. And our work's been made a little easier because of the recent phenomenal work that's taken place around the Commission for Investment in Health and some of the publications around the value of investing in human capital and human development. The benchmarks that we established, and this is again work in development, these are not cast in stone, were several. Of those, clearly the targets, although we focused on saying MDGs and beyond, but whatever the sustainable development goal targets and indicators are going to be, we've got to align ourselves around what our inputs and contributions to those targets may be like. Economics, so principally assembling and reviewing strategies for investments, economic analysis of integrated approaches, and what is going to be our message at the end of these 3 years. Investing X dollars in this will lead to what? And where should those dollars be invested? That has to be a very important output of our work. Then if you're going to make that case for that increased investment, how do we measure progress? How do we measure success? So if the forum comes out with some key messages, 10 years down the line, how will history and people judge us in terms of what has been our contribution in the global landscape? We've also got to help people beyond the mission and vision statements. So for countries, for policymakers, for people who have to actually implement, we also have to have very clear guidelines on implementation at scale. So some of this investment jargon has to also translate into the how. What are you going to invest in and how you're going to do this? So I think implementation was underscored as a very important part of our work. There are other things that were put on the table, and they are extremely important and need to be considered. Engagement, making sure that we don't lose sight of our stakeholders, and notably a combination of top-down and bottom-up was underscored. And that engagement is largely what is designing some of these forum activities in key geographies. So as I understand, we are going to be meeting in many different countries. We go from here to Delhi in India, we go from there to Brazil this year, and we would be spread over key geographies, including Africa, just so that we hear from people and are also able to contribute something to the ongoing discussions. We're not the only people thinking about future investments in human capital, but it would be great, just like many other global commissions, to have this forum also participate across the global landscape. I think integration I've already mentioned. At the end of the day, this has got to bring people together, and then capacity development of people, communities, governments as we move along. We spent a lot of time in January on group work and in identifying some of the key themes around workshops that would take place. And I'm not going to go through that entire list, but just to underscore that there were some key elements that emerged. So economics implementation and scalability emerged, need for common knowledge, evidence synthesis and generation. So we all sing from the same hymn sheet. So we have the same set of interventions that we talk about. There was a thought expressed in January that in looking at prevention, promotion, and moving forward on investments to promote human development, that we ought not to leave behind children and families who have to deal with existing disabilities. And that's a very important message that we have to somehow or the other include within our discussions. So the burden of human disabilities, both tangible and those that are subclinical and not recognized, is not insubstantial. It is there, and we've got to bring that element in within our dialogue. It's not entirely clear how that will be done, but certainly it's something that we need to be very cognizant of. There was a thought, although we didn't quite come to grips with how we will handle this, and this might be something for 2015, which relates to prioritization, that at some stage there has got to be a hierarchy of activities, and some hard but clear decisions would need to be made where investments and where the focus for governments and policymakers ought to be. And that, in a nutshell, is the summary that is explained in greater detail in the documents that you have of our first planning workshop, which I thought was illuminating. I certainly learned a lot in that workshop in terms of the dimensions that we hadn't thought about. And I'm sure this particular workshop will be no less. If anything, it will push the envelope a bit further. So I'm going to stop at this stage and throw the floor open to forum members who were part of that January workshop and may want to add some elements to it. We also have in the room Kimber, who's been the leading spirit behind a lot of these activities, and Patrick from from the Academy, and I would welcome if you would like to say anything at this stage before we get on with our formal proceedings. Forum members, anyone wants to add anything? Those of you who have been behind, I'm looking at Joan to say if you want to add anything, those of you who have been behind some of the thought process in this. And I'll also open this to our distinguished non-panel members, speakers who we are hoping to hear from. If you have any overarching thoughts on issues that we may not have discussed or tabled right now, you don't see in front of you, this is your opportunity in this opening hour to make your case. Sure. We'll get you a mic. So introduce yourself, Jerry. Give you.
Jerry Bierman, an economist from the University of Pennsylvania. I think many of these goals are quite admirable, but very challenging. And one dimension of the challenge which concerns me a lot is, and I think some of your work is very consistent with this challenge, is the tremendous heterogeneity in conditions across the various countries that we're interested in. You've done work on the heterogeneity in costs, for example, recently. But it's not only in costs, it's on impacts, it's on the budgetary possibilities, et cetera. And so as in any effort of this sort, on one hand, you want to present a broad, sweeping summary of what you've learned, but for it to be, I think, very useful, it also has to have some very concrete, context-specific, at least illustrations, perhaps by focusing in on a few countries and a few particular possible interventions or something like that.
Thank you, Jerry. I completely take that point, but I personally also believe that there's more that unites us than divides us, that although contexts vary, some of the fundamental principles are the same. What can I tell you more than that we've spent the last 6 years through a generous project funded by the Bill and Melinda Gates Foundation on solving one of the greatest riddles that there is. So as you know, there are now international growth standards for children done through a very rigorous exercise spearheaded by the WHO on defining growth amongst children all over the world, varying contexts, varying ethnicity, varying geographies, to answer one question. If you had unconstrained growth, if you'd removed some of the visible, obvious, known risk factors, do children grow the same across the world? And the answer is yes, absolutely. The international growth standards that we have through WHO answered that fundamental question. The next big challenge was, does the same operate in fetal life? So if you remove the constraints from mothers, both when they become pregnant or pre-pregnancy, what is the trajectory of fetal growth? All of this big question of the environment and geography and history determining some of that trajectory. Very soon you will see in press the outcome of that exercise over 6 years through a consortium working in 8 countries, where that answer is absolutely, that if you remove some of those constraints and look at people who don't have any overt morbidity, do not have any obvious constraint due to other disorders, have optimal nutrition, no drug abuse, that intrauterine growth trajectories of children, fetuses, are the same worldwide. Isn't that phenomenal? I think these two big global efforts of defining how children grow globally are one of the most heartening sets of multi-center collaborative research that has taken place. And what it tells me is that yes, context will differ and constraints will be enormous, but our objective of trying to define optimal trajectories through resource allocation and targeting to reduce those disparities are absolutely appropriate, because our vision in terms of achieving a particular trajectory has got to be the same. So sorry, the long-winded answer to a challenging question, but that's the question that's in front of us. What can we do for children worldwide so that everyone has the same potential?
Yes, Rana Haji, CDC. Thank you, Zulfi. I mean, not to add to the challenges, and I know it's very hard to cover the differences across countries. I agree that there are guiding principles. Last time we also discussed the need to have good, at least regional representation. We cannot have every single country. We have at least regional representation because some of the regions have their own issues, and at least we can customize them to regional needs. And also we discussed the special needs of children who live in regions of conflicts or countries of conflict, as this is a growing population that also requires special attention. And at least many of the UN agencies have been heavily involved supporting these kids. Thank you.
Completely agree with that, and that's why we are going to move between various regions to have those voices heard. Any further thoughts? If not, then I would suggest, Kimber, that we save ourselves some time and move into our next session, perhaps a little ahead of time. So what I would like to do is now turn to the moderators for the first session. I don't have the sheet in front of me, but let me see. So our first panel is on the science of development potential. And this will be moderated by none other than Kofi Morpho. Kofi, welcome. And the speakers in this session are Michael Georgiev, Maureen Durkin, and Robert Serpel. And I'll leave it to you to steer us through. And perhaps finish a little ahead of time.
Okay.